Hello everyone. In this video, I am going to talk about reflex epilepsies. There are four different types of reflex epilepsies which are commonly seen. One is startle epilepsy, reading epilepsy, photosensitive epilepsies, and hot water epilepsy and bathing epilepsy. In this video, I am going to concentrate mainly on photosensitive epilepsies. There are two different scenarios which can cause photosensitive epilepsies. One is primary photosensitive epilepsies, wherein photosensitivity is the main reason for the epilepsy. The classical examples are photosensitive occipital lobe epilepsies, also called as pole, then epilepsy with eyelid myoclonia, also called as jeavon's syndrome, then sunflower syndrome. Then another set of seizures which can have photosensitive triggered seizures are generalized epilepsy syndromes. There are various idiopathic and genetic epilepsy syndromes which are primarily not photosensitive, but they are epilepsy syndromes wherein photosensitivity can sometimes trigger seizures in them. So let us see primary photosensitive epilepsies first. So as I told, there are three different types of primary photosensitive epilepsies. So one is the photosensitive occipital lobe epilepsy. Then we have epilepsy with eyelid myoclonia, also called as jeavon's syndrome. Then the third one is sunflower syndrome. Let us see photosensitive occipital lobe epilepsies first. Classically, it is seen in the age group of 4 to 12 years, and seizures are precipitated by light stimuli like video games and TV screen exposure. The seizure semiology includes visual blurring, hallucinations, then blindness, head and eye version and vomiting, and it may last for about a minute, and rarely progressing to GTCS. So classically, a child who is watching TV or playing video games suddenly has a blurring of vision, which is transient, or may have blindness. Then they may have the child may have hallucinations also, and there may be associated head and eye version and vomiting, which may last for about a minute. And this is very classical of pole or photosensitive occipital lobe epilepsy. Then the second one is jeavon's syndrome. Here, the classical age group is 2 to 14 years. Seizures are precipitated by eye closure. Seizure semiology includes eyelid myoclonus, which is characterized by repetitive upward myoclonic jerks of the eyelids. Then there may be upward eye deviation, sometimes head jerks, and sometimes associated with absent seizures and GTCS. So classically, the child will have, upon closure of the eyes, eyelid myoclonus, which is characterized by repetitive upward myoclonic jerks of the eyelids, then upward eye deviation, and sometimes they may have head jerk and may progress to GTCS sometimes. Then the other syndrome of photosensitive epilepsy is the sunflower syndrome. The age group is 2 to 8 years. Here seizures are precipitated by exposure to sunlight, and it is characterized by something called heliotropism, where there is a compulsive attraction to sun or any artificial light. The seizure semiology includes stereotyped movements like hand waving. They wave their hand in front of their face, and they have turning of the body towards the sun. So they turn towards the sun and then they wave their hand in front of their face. There's a very classical manifestation of sunflower syndrome, and it may be associated with eyelid myoclonia, absent seizures, or GTCS. And 50% may have associated attention deficit hyperactive disorder, ADHD. So the treatment of this photosensitive epilepsy is mainly non-pharmacological, wherein we have to ask the child or the patient to avoid exposure to TV, mobile, computer screen for a long time, or avoid it completely as far as possible. Then covering one eye in bright light, especially when they suddenly get exposed to a bright environment, they have to close one eye and they can see through the other eye. Then better to use sunglasses when they go to sunlight. If they don't respond to this, or if they have recurrent seizures, then pharmacological therapy with levetiracetam and sodium valproate can be an alternative option. So the diagnosis of photosensitive epilepsy is mainly by the history. Here, since most of these epilepsies are in the pediatric age group, the child may not be able to give proper history. So we need to ask detailed history from the patient's parents or the observer. Can we trigger these epilepsies artificially in the laboratory or in the hospital? Yes, we can. When we record the EEG, what we do is something called photic stimulation, where the patient will be lying down on the EEG bed with the electrodes connected, eyes closed, and we deliver photic stimulation, a photic stimuli of various frequencies, and then see the EEG change. If one is lucky, you may get changes observed upon photic stimulation that is suggestive of photosensitive epilepsy. Now, little bit about photosensitive seizures occurring as a part of generalized epilepsy syndromes. Here, as I told earlier, these epilepsy syndromes have different types of epilepsies like myoclonic epilepsy, generalized tonic-clonic, or absence seizures, or whatever, many different types of epilepsies. Sometimes these can be triggered by photosensitivity. So they do not classically belong to photosensitive epilepsies or reflex epilepsies, but here in them photosensitivity can be an associated feature. So some of the examples of these epilepsy syndromes are juvenile myoclonic epilepsy, juvenile absence epilepsy, childhood absence epilepsy, myoclonic epilepsy of infancy, then Dravet syndrome, Lennox-Gastaut syndrome. Dravet syndrome is a type of epilepsy syndrome wherein the seizures occur within 1 year of life. Especially the first episode will be during the attack of fever, and subsequent episodes may not be associated with febrile episode. And usually it is due to mutations in the sodium channel, which is seen in about 80% of children. Lennox-Gastaut syndrome is classically characterized by multiple types of seizures. Then Lafora body disease, Unverricht-Lundborg disease, Murph syndrome. Murph stands for myoclonic epilepsy with ragged red fiber. It's a mitochondrial disorder. Then neuronal ceroid lipofuscinosis type 2. So these all epilepsy syndromes can be triggered by photosensitive stimuli. So I'll concentrate only on juvenile myoclonic epilepsy because it is the most common generalized epilepsy syndrome of childhood. It's also known as John's syndrome or impulsive petit mal syndrome. Triad, it's characterized by the triad of myoclonic jerks, GTCS, and absence seizure. Drug of choice is valproate. This is in brief about photosensitive epilepsies. And what is startle epilepsy? Here, any unexpected sensory or whatever stimuli can cause startle response. Normally all of us startle when we suddenly get exposed to unexpected stimuli. In this reflex epilepsy, like startle epilepsy, where unexpected stimuli can trigger startle followed by GTCS or convulsions. So that is called startle epilepsy. Then there is something called reading epilepsy. Here, reading for a long time can trigger epilepsy. So need not be reading always. It may be anything associated with language function. Like it can be writing, it can be communicating with somebody else verbally, or it can be reading. So how to manage this? The best way is to tell somebody with this condition to avoid reading for a very long time, or avoid certain text format which can trigger epilepsies, which they can learn which pattern is going to trigger epilepsy, and they can avoid it. And frequent breaks in between reading is also helpful. Then hot water epilepsy or bathing epilepsy. Here, as the name indicates, the moment they take hot water or lukewarm water, head bath, especially head bath, they develop seizures. Then bathing epilepsy is almost similar to hot water epilepsy, but here in bathing epilepsy, in addition to loss of awareness, they can have associated autonomic symptoms. That's the only difference between bathing epilepsy and hot water epilepsy. So the best way to manage is to ask them to avoid head bath with hot water or lukewarm water, or in spite of that, if they have this epilepsy, you can advise them to take clobazam 5 to 10 milligram 1 hour or 1.5 hour before taking bath. So what is the basis of all these reflex epilepsies? Why light stimuli should cause epilepsy, why hot water should cause epilepsy, or why reading startle should cause epilepsy? It is because of abnormal connection between different areas of the cortex. Like for example, in case of hot water epilepsy, the somatosensory cortex, which carries or which receives hot sensation, has got a reflex connection with the motor cortex, which can result in epilepsy. Like that, occipital lobe can have connection with the motor cortex, leading to epilepsies or convulsions. This is the basic mechanism behind reflex epilepsies. So this is in brief about reflex epilepsies. So 4 categories. In that I've concentrated mainly on photosensitive epilepsies. Thank you.